Hey everyone, Luke here, dietitian from Active Health Clinic. Hope you're having a great week. And of course, I hope you are enjoying the content we're putting out for the month of Awareness Months. I'm coming to you today specifically to talk about an issue that I often hear patients ask me about in hypermobile spectrum disorders and Ehlers-Danlos syndromes, which is should I or should I not supplement with collagen? So I've done a little bit of digging and I've had a look in the research, and there's a systematic literature review published in 2021 entitled The Effects of Collagen Peptide Supplementation on Body Composition, Collagen Synthesis and Recovery from Joint Injury and Exercise. And this study has looked at the bulk of the evidence around collagen supplementation and whether it is worthwhile in each of those outcomes that are in the title. Now, the important part for me looking into this was actually does collagen supplementation, so whether that be through capsules or tablets or hydrolyzed collagen protein or HCP supplements, does that actually lead to an increased collagen synthesis in the body that could be used to help us with some of the implications of our hypermobility spectrum disorders or connective tissue disorders? Well, what this study found was that collagen synthesis rates were elevated with collagen supplementation. So you drink your HCP or you take your tablet, and if there was 15 grams of collagen in that product, then yes, it was helpful to actually increase collagen synthesis. However, the important part in this, and something I've been talking about for a couple of years now, is that there was no significant difference between having a collagen supplement, 15 grams per day, versus having another protein supplement, so a whey protein shake or a casein protein shake or a soy or pea or rice or fava bean protein if you need the non-dairy option, right? There was no difference between actually taking the collagen supplementation versus the non-collagen, higher quality protein source supplementation in how that affected collagen synthesis. We had increased collagen synthesis in both groups. And that's really important to know because sometimes we actually have a look at these collagen supplements and they're filled with a lot of other different stuff that we don't need or we might be intolerant to or we might react to. Yet we want to actually increase the collagen synthesis in the body to help with our joints and keep things in place and potentially help with our gut function and all of those things. So my recommendation for a couple of years now has been having extra protein in your diet when you live with a hypermobility spectrum disorder, connective tissue disorder, HSD, whatever, could be beneficial, and in fact looks like it is beneficial. However, it doesn't really matter too much where you get that protein from. You may not even need to have a protein supplement. You might get enough protein in your diet as well, but that really can only be assessed individually by a qualified person like a dietitian. So if you're wondering about this, that might be a question that you need to ask one of us. But I just thought I'd jump on and actually give you that info for today. And hopefully it helps you answer a question that you might have had about your condition and about nutrition in your condition. In any case, hope, like I said at the beginning, you're enjoying the content that we're putting out this month for all of our awareness months, particularly the pajama-based content. I know that's been some of my favorite. And in any case, as usual, if you've got any questions or want to know more about this, feel free to drop a comment below or get in touch with us via any of our channels, and we'd be more than happy to chat. Take care, happy eating, and happy Awareness Month in May.